Today we have a topic that John and I have brought up and discussed how many times over the last 10 years?
Times, yeah,
countless times. So, John, which topic are we going to be going over?
So I thought what we could look at is health rates throughout the United States and compare them to other countries, as well as diet and nutrition, and why it is America is just sort of leading the way in all of the health-related problems instead of all the health-related solutions.
You're listening to It Might Be Interesting with your hosts, Josh Levy
and John Walsh.
Now, there's an endless amount of information out there on any given topic.
And sometimes you just need somebody who can extrapolate it in a way that might be interesting. So, Josh, one of the key indicators for measuring obesity is BMI.
Yep.
Can you talk about what BMI is, how accurate it is as an indicator, and what, if any, weight people should put on that metric?
Yeah, you bet. So BMI is your body mass index, and it's called that body mass index because it is basically a calculation of your weight in kilograms divided by the square of your height in meters. So I know it seems a bit odd, and for instance here, if your BMI from that calculation is less than 18.5, it falls within a range of underweight. If your BMI is between 18.5 to roughly 25, it falls within normal. If it's 25 to 30, it's overweight. And if it's 30 or higher, it falls within the obese range. To give you a better idea and allow you to visualize it better, I have some calculations based on like average male and female that we can dive into. But
let's take a look.
Before that, I'll just mention for this, the cons are it doesn't factor in things like muscle mass. You know, you could be The Rock is probably, his BMI is probably considered morbidly obese.
Yeah.
know, and there are situations where there is there is a margin of error to it. However, the reason this is good is it does apply the same rule, the same formula, the same calculation across the board for everyone.
So if you're measuring obesity rates throughout the world, this kind of just gives you a running average. It may not be the most accurate thing, and it certainly doesn't depict health, but it's a good indicator to figure out where you kind of rank, right?
Yeah, it's where you rank, but also the body mass index was created as and again, like it is a general indicator, but it's an indicator that a lot of doctors came to the conclusion with by saying, okay, there are a lot of people with diabetes, heart disease, all these different things. They found out that their BMI was pretty good indicator. Like if your BMI goes from overweight to obese, your risk of a heart attack doubles. For things like diabetes, heart disease, things like that, and any obesity-related illness, they say, this is a pretty good, it's the current best way to easily identify.
Okay. Well, let's take a look. What kind of averages? Let's take an average male. What does that look like?
So an average male, 5'9", if you're under or up to 130 pounds, you're underweight. If you're 5'9", between 130 and 170, you're considered a normal weight or normal BMI. If you're between 170 and 210 pounds, you're overweight, and anything over 210 is considered obese.
So how about female?
Yeah, for female, it's 5'3" is the average height. If you're under 110 pounds, you're considered underweight. Between 110 and 140 pounds, it's normal weight. Between 140 and 170 pounds, it's overweight. and anything over 170 is considered obese.
So the World Health Organization does a breakdown of, obesity rates throughout the world, and I thought we could take a look at where the U.S. ranks as well as other, countries, Western, non-Western. So I threw a link in the shared drive there, Josh, and I thought we could take a look at it.
Yeah, let's do it.
So if we're looking at North America, we'll start with the U.S. Our obesity rate in the United States is at 36.2%, which is one of the highest in the world. And if you go to our neighbors to the north, Canada, they're just under 30% at 29.4, and our southern neighbor, Mexico, is at 28.9%. So you can see that throughout the U.S. and North America, we're trending at a high obesity rate. So are we seeing that same trend throughout the eastern part of the world?
Yeah, we're seeing it in a lot of places, but it is very regional. So, for instance, Northern Africa and the Middle East, there is roughly the same level of obesity. It's only a couple percentage points lower than America in Northern Africa and the Middle East. When you get into Sub-Saharan and Central Africa, that's when it really drops down to even around the single digits. So you go from like 37% down to 8% obesity, but obviously that has to do with a lot of malnourishment. These are a lot of like war-torn countries with not a lot of resources stuff. But then when you drop into South Africa, which, Southern Africa, so you'll have like Zimbabwe and South Africa itself, you get back into a more normal range in the high 20s, low 30s, or I shouldn't say a normal range comparatively to the United States normal range, which I thought was interesting, because if poverty was an indicator, or a very, very significant one, then South Africa probably shouldn't be that close to the United States, in my opinion. I think I would assume it would be lower just because the poverty rates there, you have millions and millions of people living on the equivalent of under $2 a day, the townships and everything. So, I mean, that was kind of what surprised me a bit.
It is strange. I mean, like, when you look at it regionally, it's just right there on the Mediterranean. You see, a higher obesity rate versus, Sub-Saharan Africa and South Africa. What's the obesity rate in, let's say, France or Spain or Portugal in comparison to the U.S., or even these ones in the Mediterranean?
Yeah, so it's funny you mention it. I jumped like right into France because not only do they love their food, they do love rich, creamy, fatty food, but they're more than 10 points lower, so they come in at about 21%.
To the U.S. is 36%?
Yeah, exactly. So that was surprising to me, at least, that you would have France at 21 compared to 36. And it's pretty much the same throughout Western Europe. I know, and parts of the Mediterranean. It's a little bit lower. You jump down just below 20% in Italy and Switzerland. That's no surprise there. But with even most of Eastern Europe, and you jump into Russia, 23%, a couple percentage points above France, but you have a huge region of the world in the low 20s, and you have China and India. They are very low. India's at just below 4%, and China is in just between 6 and 7%. And we can say almost unequivocally that part of a huge reason India comes in at such a low number is because of the malnourishment and the poverty there. But
they do have a starkly different diet.
Yeah,
than the U.S.
they do as
They're
well. Like,
largely a Hindu country. They don't eat a lot of animal products.
yeah, and it's interesting you bring that up because these are countries that are booming economically compared to where they were just a year ago. Every year they're like doubling, they have more and more means for food, yet they are not getting more and more obese, if that makes sense.
I mean,
So
3.9% compared to the 36% in the US, or like in Brazil, 18%, Canada, 29%. India is running at less than 4% obesity. Now, that there could be other reasons, such as lack of motor vehicle, and walking great distances and
right.
things like that added into it. But still, it's just like, it's a significant difference.
Yes, there are a variety of these factors, but the 800-pound gorilla in the room is diet.
I mean, if you're just looking at the obesity rates, it's staggering. And one thing that I just noticed on here that is, I think, really interesting, if you look at Singapore, or excuse me, Indonesia, their obesity rate's at just under 7%, at 6.9. That Indonesia shares a landmass with Papua New Guinea, who jumps up 15% to 21% obesity on the same island. And it could be that they're getting a lot of their food imports from their neighbor Australia that shares more of an American diet, and they come in at 29%. And if you go over to New Zealand, they're in the 30.8% obesity. As we roll out into some of these other islands, like Fiji is at 30%. So if you scroll over to Samoa, their obesity rate is at 47%. And then they have some neighboring islands like Tonga at 48%. And Fiji, I think I already mentioned, was at 30. And then this other island, which I believe is pronounced Niue, Niue is how it's spelled, they are the highest in the world at 50%.
Here's something with this map. This is it gives you a lot of options in terms of gender and region and year. So I want to ask you, John, if I took you back to 1975,
Okay.
how many countries do you think would have an obesity rate over 20%?
40% of them.
Zero.
Seriously?
Zero countries. In fact, America, which was still the most overweight, their obesity rate 11.9% in 1975. And now let's take a look at 1980, where it jumps up a little bit, 13%. Between 1980 and 1990, it jumps up to 18. So it's going up gradually. But then from 1990 to 2000, that's when it goes from like 17 to 25. You start seeing like a much more drastic increase in, I'd say between 1980 and 2000. I know that's a pretty big, that's a 20-year gap. It literally goes from 11 to 26%.
Plus another 10 by today.
Even the other countries we mentioned in the Middle East that have an obesity rate relative to the United States, or Australia, parts of Western Europe that are relative to the United States, no country by far comes close to as rapid a rise over time of obesity in that time frame as the United States. So, John, there's a study done by the American Heart Association that you found doing research, and you posted that I personally love, goes into just a lot of detail, and I could spend weeks and weeks going through it and reading into it. But if you don't mind, tell us more about this research.
So yeah, this is from the American Heart Association, or the AHA. And they take all sort of aspects of human health and just kind of break it down and give some statistics. So just some of the overview of what they do look at is like nutrition, physical activity, smoking or tobacco use in general, what percent is overweight, high blood pressure, diabetes, metabolic syndrome, total cardiovascular, kidney, so forth and so on. So they just kind of give some interesting statistics, and you're right, you can get lost in these just, going through how many, just what our rate is.
Yeah, for obesity, overweight and obesity essentially shows that in just the past decade, it shows among children under 18, the increase from obese to extremely or morbidly obese, thankfully, hasn't really changed much. However, among adults, it says based on the research, it has grown significantly in just one decade. This is explicitly for nutrition is causing an alarming number of adults to go from obese to morbidly obese.
One of the things that I found just staggering, just unbelievable. In 2017, the cost of diabetes was estimated at $327 billion, which is up 26% in just 5 years.
Holy cow.
1 in every 4 healthcare dollars is spent on diabetes. I mean, it's just like, it's unbelievable that not only has it gone up, but we see a precipitous incline in the cost.
Right.
In just 5 years. I mean, half a decade, we see it increase by 26%. What's it going to be, in 2040, 2050, 2070? It's insane. Type 2 diabetes is known as adult onset diabetes. Mm-hmm. Before 1980, not a single case was found in children. Last year, we diagnosed over 100,000 children with type 2 diabetes.
Jeez.
So not only is it getting worse throughout the country, all types of diabetes is getting worse and starting to cross-migrate into areas that it wasn't in previous. So in the U.S., heart disease is the leading cause of death for both men and women. About 630,000 Americans die from heart disease every year. That's 1 in 4 Americans.
When you look at a map, so if you can kind of imagine from the northeast of United States, kind of sweeping down, so imagine northeast, very far, Maine, all the way to Michigan, that part, sweeping down through Texas. There we have the highest density of heart disease death rates. So this is a map showing, based on data from the National Vital Statistics System, as well as data from the National Center for Health Statistics. It shows the heart disease death rates for adults over 35 years old, and these are death rates per 100,000, so a death per 100,000 people. So in that area that is broken down by county, you're looking at about between 400 and close to 1,200 deaths per 100,000 people. And then if you can picture next to Michigan, where you have like the Dakotas and sweeping down across Colorado to Arizona, New Mexico, there you have, less than half. You have between 100 and 300 deaths per 100,000.
What's interesting about this is, you're right, it's based on, like, it starts with the 103 to 284 deaths per 100,000. They give kind of like a peach color. And then your most aggressive, the 400 to 1,100, is your darkest red. And it really does, like you were saying, just look like a paintbrush from the Northeast down to Texas, where you find the majority of heart disease. It's a diagonal swoop. And again, as you pointed out, from Michigan to Arizona, that's mainly a peach color.
Right.
So what I found interesting about this is, if you look at Louisiana, Alabama, Mississippi, Arkansas, Oklahoma, it's almost all dark red.
Yeah.
And if you look at Colorado and Minnesota and Oregon, those are the only three states that I can tell that don't have dark red. Well, maybe it looks like Wyoming as well. But the rest of the states have, heart disease problems by, up to 1,200 for every 100,000 people.
Right.
It's insane.
Yeah, and to me, what's crazy is, you'll see it kind of the rates spill over into another state in most cases. Like Oklahoma and Nebraska, kind of spilling off into each other and then down into Texas. Like it kind of gradually bleeds through. Let's be real. Like this isn't knocking any region. Like I travel a lot for work and I go to the South and I friggin' love it. The food there is great. It really is. And the variety and diversity of food is unbelievable down there. And diversity of authentic food, authentic restaurants. So, but there is kind of a stereotype of diet in America, like the fried food in the South.
Yeah.
In Colorado here, it's unbelievable how quickly the health movement has taken over and how much people are rejecting, processed stuff for healthier stuff.
I think diet has a lot to do with it. And when you have a lot of deep fried foods traditionally within a given area, that you're going to see an increase in heart disease.
Right. And, the thing is, like, you could look at Colorado, and I know we're known for our we have a lot of people who are extremely active. They come here, they go to Boulder, they basically rock climb to work.
Or ski.
Yeah, ski to work in the morning and then rock climb home.
We are one of the more active states. And if you cross-reference this map with the obesity rate, it's going to be pretty much in line because Colorado has the lowest obesity rate in the nation.
That's true. But it's striking to me that it is a combination of the two, but I just can't help but see this like diet and nutrition correlation, because if it was more heavily related to exercise, then Colorado would be just such a standout on this map.
Yeah, and what I find interesting is you have those southern states that, are very dark red, almost across the entire state. I mean, Alabama especially, there's only one part of it, one county that is peach.
Yeah, and Georgia.
Yeah. It's pretty staggering. But then when you go over to California, a more, diverse country, or state rather, you see all along the coast, it's a very low rate. It's all peach. And it's once you get into the inland, into the rural parts, and I think it comes down to food options. So we looked at heart disease, we looked at obesity. I want to look at one other disease, and that is cancer, and how cancer is rolling out throughout the world. Now, before we even get started into this, you noticed a trend between the two maps that we've looked at?
Yeah, so this map is, let's just say if it was a slightly different shade of green. They use shades of green from very light green, few instances of cancer per 100,000, up to dark green, so like virtually 0 per 100,000, all the way up to over 300 instances per 100,000 people in dark green. If the green color itself, the pigmentation was a little different, it would look exactly like that obesity one. That went from light green to dark green. This is a little more of like a teal, I'd say. But if it was the same green, I would probably at first glance think I was looking at the same map, honest to God.
Yeah, if they overlaid the obesity map to the cancer map, you wouldn't have very much color divergence.
There is a bit of a margin of error. However, even with that margin of error, this map looks the same.
Yeah.
Yeah.
So here's what I wanted to point out, and something I came across a while ago. Both you and I work in the tech industry, and we know a lot of people that come here from India. And whenever you talk to them, they'll say that when they go back home to visit family, the one thing their family always says is, "My God, you've gained weight."
Yep.
Right? And so I wanted to kind of contrast the two countries real quickly. In the United States, and this may blow you away, last year, reported deaths of cancer, just reported cancer, was 2.1 million people in the United States. Okay? India has 4 times the amount of people we do. And last year, the reported number of cancer, and this isn't per capita, was 1.1 million, half of what the United States reported in cancer.
So if we had the same population, we would be between 8 and 9 million compared to 1 million.
Right.
We have essentially 8 times as much, based on if you were to level out population.
Right.
It would be 8 for every 1 person in India. We have 8 people.
Here's what's fascinating, though, in addition to that, is it's not the same type of cancer. So in both countries, breast cancer is the number one, right? Okay. So this is per 100,000 people. In the United States, women with breast cancer is 84.9 per 100,000 women. In India, it's 24.7. It's still number one in India, but it's, a third the amount of patients. Number 2 for the U.S. is prostate, but in India, it's cervical cancer.
Yeah, and those are directly related to, they absolutely have, again, a hereditary component. There are a lot of things that can affect it, but there are some of those that are undeniably linked to things like diet. Like you go see a doctor and they will tell you your diet gives you an increased risk in blah blah blah, certain types of cancer, and those are ones that do come up quite a bit. And it is, to me, shocking that another country that we have just the highest rates, and that's actually a much higher difference than the obesity rate too, because our obesity rate is pretty similar to like Western Europe, and there are a couple parts of the world, so a couple places in South America. However, when it comes to the cancer rates, we really do stand out more, don't we?
Yeah, if we go back to the obesity chart, our obesity rate is at 36%, as opposed to India's 3.9%. Our cancer rate for every 100,000 residents is 352, or a total of 2.1 million, versus the cancer rate in India, which is 89 per 100,000, which comes out to 1.1 million. So, you can contrast that with a lot of countries throughout the world. You see cancer rate in, like, let's say France, they are, 344 per 100,000 versus 352. So not a huge difference between France and the U.S., but I think you may be right that it is linked to diet. That diet is probably causing cancer, and to have these disparities between the two countries, I find it so fascinating and amazing. And when you look at France versus the U.S. on the types of cancer, they're far more in alignment. So breast cancer, number 1, prostate, lung, colorectum, NMSC, and then some of the other, like what is that? Uterine.
Uterine.
Yeah.
And one thing one last thing for me that I noticed is you look at, like, for instance, stomach cancer. You look at all the types and then look at, various parts of the world. You click on stomach cancer or, colorectal, one of those two, and suddenly it's like certain countries completely flip. They go from almost no instances of other types of cancer, and then all of a sudden, bam, they have a massive increase in stomach cancer. And those, again, are countries that have seen the most drastic change. And so, for instance, United States, the diet we eat is the diet we've been fed since we were kids, and it's the diet it's worse than the diet our parents had, but it's essentially like the common American diet, the whole fast food industry, everything, since 1950. Like, this is the staple. But in China, Japan, places like that, in Southeast Asia, they, up until the last like 10 to 15 years, there wasn't McDonald's, there wasn't fast food. Like, it was very traditional. And then I think, again, this is a theory I'd love to hear people's thoughts on as well, because to me it's like when you change something so drastically, and over the course of like 10, 15, 20 years maybe, that could indicate, that could be why you suddenly go from very modest rates in other forms of cancer to, bam, stomach cancer goes up significantly, drastically more. It's, higher. That's one area where it is higher than the United States. And I think maybe it is because the United States, it's like we are, and, this is equally bad in a different way, is we're kind of acclimated to our diet. Like, we don't even really most of the time think twice about it. Even someone like someone like myself who likes to think I'm very conscientious about it, not really, compared to how much I should be.
So one of the other things that they rate on here is the NMSC, which is acronym for melanoma, or rather skin cancer. And I was just looking at Australia, and that's their number one, is skin cancer.
Doesn't surprise me.
And it's 468 out of every 100,000. I mean, it's like it just jumps out. I wonder why that is. That's fascinating.
I mean, I know in Australia, so I wish this map, I don't know, I think you have a different version of it. Does it just give the country? Are you able to break it down? Because I'd love to see coastal United States, because in Australia, the vast majority of the population lives along a coast of, like, you'll have Melbourne, Sydney, the vast majority, because the rest of it is like the outback. And so those places, just like in, certain coasts of the United States. And my dad was telling me, in South Africa, when he lived in Cape Town, I mean, you were on the beach outside all the time, shirt off, and he knows just countless people who have gotten skin cancer, and thankfully his wasn't melanoma, but he's had it a few times, benign things. And so I do have a feeling in Australia, culturally too, it's a very, very outdoors, shirt off on the beach kind of place. And I bet you anything that's probably got to do with it.
Yeah, I don't really have a breakdown of like the area of the country. This is off the World Health Organization. It's more like a grand total. I do have this other map that shows ranking of cancer in premature mortality from ages 0 to 69. And we see kind of a similar trend of, Central Africa, and then Saudi Arabia all the way over to India shows the least amount of premature mortality. Whereas your Western countries all through Europe, North America, and Australia, as well as Argentina and Chile, they have higher rankings of cancer, whereas the second highest will be Northern Africa throughout Russia and China. It's interesting.
Yeah, when I saw that, I thought, like, that blew my mind because the countries, the vast majority of these countries, so you have United States, Canada, Western Europe, Australia, a couple others. These countries, you'd think if you were diagnosed with cancer, any of these countries you would take over, African countries or whatever to get treated, right? Like you wouldn't, you'd rather go to like the Mayo Clinic here than, some random clinic or whatever. So, I mean, that shows how bad it is for us. Like, we have the best treatment centers, best doctors, best everything, yet we still have a higher mortality rate. Like, that is
insane.
Yeah, it's insane. It shows how no matter how much we have improved with medicine, and thank God we have, like, there are, forms of cancer that were a certain death 10 years ago that, people survive today, with a much higher success rate, but it's almost like the cancer is growing faster than our ability to cure it. Every one step forward, the cancers and the people who get it, number of people, it doubles. That increases twofold, and it's just impossible to keep up.
It really makes you think about prevention measures and what we aren't doing that other places are.
Yeah, exactly.
So one thing that has become abundantly clear doing this episode is not only is the problem bad, but it's getting worse. So I just want to play a clip of someone who saw this trend about 10 years ago and what she thought we all needed to consider.
Now, I know that the focus of this year's meeting is the issue of healthcare. And over the next few days, you're going to be talking about spiraling costs that are straining your budgets and running up all of our deficits. Costs like the nearly $150 billion a year that we spend on obesity-related conditions like diabetes, heart disease, and high blood pressure. You're going to talk about the staggering Medicaid burdens and how premiums have risen 3 times faster than wages, often bankrupting families in your states, sinking businesses in states all across this country. But we all know that there's another set of statistics that have to be a part of this discussion, like how nearly 1 in 3 of our children in this country is now overweight or obese, like how 1 in 3 kids today will eventually develop diabetes. And in the African American and Hispanic communities, the number is nearly half. Because if we think our healthcare costs are high now, just wait until 10 years from now. Now think about the many billions we're going to be spending then. Think about how high those premiums are going to be when our kids are old enough to have families of their own and businesses of their own. So we all know that we can't solve our healthcare problems unless we address our childhood obesity problem too.
The reason I'm excited for next week's episode is we're going to dive into some of the additional effects that this is having. So I have some great info I'll be presenting for you all that will show the details on the impact this will have.
Yeah, I mean, if obesity rates are that high, then we have to kind of look at why. Mm-hmm. You know, if the U.S. and Canada and Western countries have a higher obesity rate than throughout the rest of the world, and the U.S. is leading the pack in that, we really have to start talking about what we're eating and what we shouldn't be eating. So on our next episode, I think we'll dig into diet a little bit. So listeners, we appreciate you tuning in once again, and we look forward to talking to you next week. And Josh, a pleasure as always.
Absolutely.
All right, so we'll see you all next week. Thanks for listening to It Might Be Interesting. Please join us next time.
And make sure you check out our website for other episodes, itmightbeinteresting.com. And we'd love to hear any thoughts, questions, feedback, and even episode suggestions you have. So if you do have any, please send it over to thoughts@itmightbeinteresting.com.